Hello there, classmates. This is Cassandra Sensenig. I know that for many of you, this is the end of the BSN road, so a job well done to each of you. I've completed my service learning project at Birth Care, which is a midwifery, birth, and women's center in Gordonville, PA. A little introduction of where I spent my time. Birth Care is a midwifery, birth, and women's center. It's a nonprofit health center that provides obstetrical and gynecological care. Birth Care specializes in home births and freestanding birth center births. They travel within like a 40-minute radius for home deliveries and home postpartum care. Otherwise, they come to the center for their care. I selected Birth Care because I wanted to experience a labor and delivery outside of the hospital, postpartum education, and office appointments. We receive patients from Birth Care at Women and Babies, but only when a physician consult is necessary or in the event of an emergency, sometimes when things are too late. I kind of have a bad feeling towards outside hospital births, and so I wanted to explore it for myself. A little history of Birth Care. It was established in 1978. It's the only licensed birth center in Lancaster, York, and Chester counties. Also serves Northeast Maryland and Western Delaware. It's accredited by the Commission of Accreditation of Birth Centers and licensed by the Pennsylvania Department of Health. It's not just babies. They also focus on providing health care for women of all ages by only women providers. Care is provided by certified nurse midwives. They also employ certified registered nurse practitioners, registered nurses, licensed practical nurses, and medical assistants. They promote a family-centered childbirth and the right to autonomy during labor and delivery at their freestanding birth center within your home, and they also have privileges at the Ephrata Community Hospital. Little description of Birth Care. The main population at Birth Care is pregnant women. I will mention that 70% of the population are Amish or Mennonite, but for the purposes of my time spent there, my focus was on pregnant women in general. The needs of the population, or issues if you want to call them that, we'll start with education. I think that each of these women need to be educated on the pros and cons of delivering outside of the hospital and the risks associated with it. I think they need to be honest of their medical history, because delivering your baby outside the hospital should be reserved only for those that are low risk. I think it's important for women to choose the right place to deliver their baby. Again, it's important for them to meet their own needs, but it is the role of the nurse at Birth Care to ensure that this education is occurring. I also feel like the postpartum education and the postpartum visits were very quick and to the point, and I felt like many questions that the patients had were left unanswered. So deliveries at home with Birth Care get 2 hours with a nurse, and then a 2-day checkup for about 10 minutes. Deliveries at Birth Care at the actual center get 4 hours with a nurse, and then they also receive the 2-day checkup. It's important for the nurses in this role to educate, and I feel like there was a lack of confidence in some of the education being provided. Many patients from Birth Care refuse the extra stuff like PKU testing, which is the metabolic screening looking for metabolic diagnoses, hearing screenings, and the CHD screening, which is a new cardiac screening that is recommended by the Academy of Pediatrics. So it's okay, it's to each their own for refusing, but I felt like it was an uninformed decision and so much more education could have been provided. Instead, that they were just handed paper forms and then were given those to read, and then refusals were signed without hesitation. Many people choose Birth Care due to lack of transportation or lack of quick transportation and lack of insurance. Also, people choose Birth Center for lower cost and the desire to experience a birth in a non-clinical setting. So how does the healthcare professional play a role in serving the birth care population? So I have the four categories here and some issues listed under each. So for social, they have a lot of mistrust and fear. They trust these providers at Birth Care and feel like the clinical setting or the hospital setting is not natural. They desire more autonomy or having a say in their decision making. So the professionals at birth care are able to offer different care outside of the hospital. They have different policies and procedures that they can follow due to not medication use. So these patients have a lot more autonomy and a lot more say in their decision making because less monitoring and stuff is needed. Many of them are against vaccinations. So again, healthcare professionals can just provide that needed education, but are also very supportive of their decisions. Political issues, lack of access or limitations on insurance. So they offer in-home deliveries or freestanding birth center deliveries, which are closer to home. Cost is a lot lower outside of the hospital, which leads us into the economic category with cost and funding. So it's lower costs and lower amount of funding needed because things cost less. Lack of follow-up care. So they're refusing the testing, like I had mentioned in a previous slide, the CHD or the cardiac screening and the PKU testing, which is the metabolic disease screening. So the Amish community in particular, just as an example, should not be refusing the PKU testing because many, I shouldn't say many, but that maple syrup disease is common within their population, and that's something that shows up on the PKU, so it would be important to know that. So again, education on the importance of follow-up care. Cultural education could be here under cultural or under social. Many are making uninformed decisions, so again, it's the role of the healthcare professional to provide that education. Much of this population, I should say, has decreased access, which leads to some of the education issue. Healthcare beliefs or cultural sensitivity. So these healthcare professionals honor what's important to them. And the barriers to access to healthcare, they offer home visits, birth center visits. The closest hospital for many of them is 30 minutes to an hour away. The design of the project. Currently, I'm a nurse in labor and delivery at Women and Babies. I contacted a midwife that works at the birth center. She used to work with me at Women and Babies as a nurse. Then she went on to get her midwifery degree, so she's currently a midwife at birth center. She gave me the name of who I needed to contact. I got in touch with the director of nursing at birth care, and we set up how my project or how my hours would take place. A majority of the project would be observation with hands-on where I was comfortable. Implementation of the project, completed all 30 of my hours in 3 days in October. I took a vacation from my job so that my focus could be on my service learning hours and birth care. I attended and assisted with postpartum visits, newborn testing, home births, birth center births, postpartum teaching, and prenatal gynecological visits. I performed maternal and infant vital signs in addition to postpartum exams. I was able to be a support person for laboring women in and out of the facility. This project was totally in my element, just way more lax at this facility and much more hands-off than what I'm used to. If I had all the time in the world for this presentation, I would go into depth with specific examples. Having worked in the hospital setting, I was forced at times to feel very uncomfortable due to uncertainty or lack of quick access in an emergency, or ways that they cut costs that I'm not used to. Project revisions and considerations. So I changed my service learning project late in the game. Originally I had started with an interest in teen pregnancy at House of His Creation, but I wasn't getting the experience that I desired, and I wanted something more hands-on or something that I was more passionate about. Allow myself more time to become familiar with the facility prior to the hours spent there so that I could have more of an impact on the nurses and patient population. Had I seen their need for education prior to my project, I could have implemented a couple of things that I just didn't have time to do. Education would definitely be a priority. So as I have there in that little picture on this page, we must be the change that we wish to see in the world. And I think education is huge regarding that in healthcare. offer a postpartum teaching tool that I created in Nursing 322 and tailor it to the birth care population. I did offer this to their director of nursing and did not get much interest, but I still may do this because it won't take me long to tailor it to their needs. I think this patient population would really benefit. I created some postpartum education cards for our postpartum patients at Women and Babies. Just a quick guide to look through some of the most common things that can go right, the most common things that can go wrong, and just kind of answers to those questions. I think that this population could really benefit from that, since most of their education is on paper form. And I would like to mention with that, like I said, much of their population is Amish, and so, many of them have an 8th grade education, and so can they even understand entirely what they're reading in medical jargon. Many of their nurses at birth care are LPNs, not all, but some, and some of them are new grads. So some would say that ignorance is bliss, but I would also argue that not many of them have a large vast of experience, and I think it can be complicated when it comes to education or comfort level. My objectives for my birth care experience would have been different again had I really known what to expect. I would have focused some of my objectives maybe on education piece, but I didn't know that prior to going. So by the end of the project, the learner will identify 3 reasons in detail why women and their families choose a freestanding birth center or home environment for obstetric and gynecological care. Identify 3 challenges related to out-of-hospital births and the policies and procedures in the event of an emergency. And lastly, evaluate and determine 3 differences between in-hospital births and out-of-hospital births and be able to gain new knowledge to enhance or expand my current professional practice. So my objectives were met by questioning patients and staff, but also through direct observation. So the first objective, why do women and their families choose freestanding birth centers or home births? So privacy and comfort of their own home and more of a comfortable surrounding. They can have whoever they want at their delivery, whereas in a hospital we limit the amount of people that can be at the bedside. More autonomy and control over their labor and delivery, so there's no augmentation, no monitoring. In hospitals, we have certain protocols and procedures that we need to follow, which can create a power struggle for these types of patients. But then we just need to document. Want to avoid a medicated birth and have a natural labor and delivery and not have those medications as a temptation in the hospital. And those without insurance or not very good insurance pay much less for a home or birth center birth. Second objective, what are the challenges of out-of-hospital births and procedures in the event of emergency? So they have lack of resources and supplies directly on hand. It's a very far distance from the hospital. In the event of an emergency, the closest is 30 minutes by ambulance. So essentially, in the event of an actual emergency, they call 911, they get to the closest hospital ASAP, which in birth care's instance is Women and Babies. From the birth center, some home births may be closer to other hospitals, but if they're at the birth center, the closest is Women and Babies, and it's about 30 minutes by ambulance. Emergencies generally come to Women and Babies and have, in some instances, arrive too late. And for me, one here and there is just too many. Lastly, what are the differences between in-hospital and out-of-hospital births, and what new knowledge have I gained to enhance or expand my current professional practice? Hospitals offer pain management and augmentation when needed or desired. Hospitals have a safer environment and have equipment readily available should an emergency or complication develop for the mother or baby. Sometimes these emergencies happen so fast without warning sometimes, and just having that equipment readily available definitely improves outcomes. Hospitals take high-risk patients. Birth care only takes low-risk patients. There's someone also always there to help mom and baby, leading to an increase in education. and questions being answered. And the example I can think of for this is breastfeeding. So there's someone always there to help mom and baby with each feeding should that not be going well, and there's just always a direct advocate or support person throughout that 24-48 hours postpartum. Hospital only employs registered nurses, most with their BSNs, which is why we're all in this program, and birth care hires medical assistants and licensed practical nurses. So into the impact of my service learning, my expectations were definitely different than my experience. So as you can see, I have a little picture here that says 2 out of 3 babies who die at home birth could have been saved in the hospital, and that was kind of my feeling going into this. And I expected, to see some beautiful deliveries and have a positive experience, and I just, again, I don't want to sound like I'm not supportive of home births, but there's an element of poor education and cutting costs that make me really uncomfortable. I was able to provide enhanced education to postpartum patients and offered reassurance. So oftentimes postpartum patients would be asking the birth care nurse, how do I know my baby's hydrated? How do I know I'm feeding him well? How do I know they're staying hydrated? That kind of thing. And the nurse would just reply, just keep doing what you're doing a great job, instead of really getting down and educating or assisting through a feeding or something like that. So I was able to chime in and answer a lot of questions, just having that experience within the hospital, and assist with some breastfeeding that otherwise wouldn't have been done had I not been there. I brought to their attention some things that were being done inconsistently, for example, weighing babies, and in need of a policy change or a reminder to all staff on the process. Some were subtracting, let's backtrack, they weigh all their babies using fish scales, and some of them subtracted 5 ounces for the sling, some subtracted 1 ounce for the diaper, but none of them were doing consistent weighing on these babies, and I think that's really important. Personal impact. Again, solidified my values and beliefs about out-of-hospital births. Increase awareness of other birthing options. And hospital has better quality of services, higher educated providers, and more resources in the event of emergencies. It was an opportunity to connect with the community, so I was able to go inside their homes, private spaces, private and vulnerable moments in their lives, and I'm extremely appreciative of that. I can learn to be more flexible and not so rigid and by the book. I have a better understanding of the importance of education that I provide my patients each and every day, no matter how small the question or topic. Increased knowledge to avoid stereotyping. I have a greater knowledge in helping others outside of the clinical setting, and natural labor and delivery is incredibly beautiful. I got to witness a water birth while I was there, and it was probably the most beautiful delivery I've ever seen, despite all of these things I've been talking about. Professional impact: educate, educate, educate. Be confident, trust in your abilities at all times. Be an advocate for my patients and their families. Enhance my skills of communication, collaboration, and leadership. Understand the importance of diversity, experience, and to get to know different cultures and beliefs, and be able to mold my care effectively. Continually facilitating critical thinking, problem-solving skills, and reflection. So in conclusion, I have here just a little saying: whenever and wherever you intend to give birth, your experience will impact your emotions, your mind, your body, and your spirit for the rest of your life. So my experience was not 100% positive of what I had expected, but I suppose I was a little shadowed by the fact that I work in a hospital setting and I know what can happen, and that's very scary to me. I actually just learned that birth care hired a case manager, case manager position, which is a registered nurse position. I actually know who was hired, which one of her responsibilities will be for education, and so I suppose that they also identified this as an area of need recently, and for that I'm extremely thankful. So thank you so much for listening to my presentation. Good luck with your paper and all your future endeavors. Have a great weekend.